Dr. Sizer, what do you tell patients with newly diagnosed CRC?
It's always very difficult when patients get the bombshell of the diagnosis of cancer. But it's important that we're clear now that the outlook is much better than it used to be, not just 5, but over the last 10 years or so. There are many more active cancer treatments available, and the survival is much improved. I think there are several reasons behind that, but one is the choice of patients and being appropriate treatment for those in different settings, but also secondly, familiarity with the side effects of treatment so people can manage their treatment and improve their quality of life overall.
Professor Heinemann, what do you tell a patient with newly diagnosed CRC?
That's an interesting question. If that patient is KRAS wild type, then we would probably have to communicate that possible survival advantage, and we would also have to communicate the possible side effects of treatment. Some patients would accept skin toxicity if they could live longer, some others would not. And so I think it's going to be within the interplay of patients and doctors that this kind of new decision making is going to take place and is going to be realized in the future.
Dr. Stintzing, what do you tell a newly diagnosed patient with CRC?
Well, first of all, I have to tell him the truth. And even though the truth is very sad for the patient, I have to tell him that he has a disease that is probably not curable, but we can really treat the disease very well. So even though we are not able to really cure him for most of the cases, there of course are subgroups that might be cured, we will prolong his life to an extent that's really meaningful without really severe side effects, because all the side effects of the drugs, all those drugs are around for at least 10-15 years. So we are very familiar with the adverse events. Those are very well treated. He will live totally normal at home. He has to be at our clinic like every 2 weeks usually, and we are able with chemotherapy to prolong life. Without chemotherapy, the median survival would be like 6 months. With treatment, we are somewhere around 24 to 30 months now.